You and your significant other have just spent countless hours in the birthing suite, pushing through contractions to bring a healthy newborn child into the world. The baby begins to cry. Meanwhile, the nurses are drying your baby off, and the doctor says it's a boy. They place the baby on your chest, and the baby is crying, but so peacefully. Your doctor comes back and asks, are you going to want your child circumcised? He tells you some general things about the procedure, but does he really tell you everything you need to know to make the right decision? In this speech, I'll explain what infant circumcision is, how the procedure removes a functional part of the body and is not medically necessary, as well as the fact that it occurs because most parents have a lack of knowledge on the subject. Circumcision is the surgical removal of the skin protecting the glands at the tip of the penis, resulting in permanent alteration of the anatomy and function. The majority of the neonatal circumcisions in the United States are performed by OB/GYNs shortly after delivery and before the mother and baby are discharged from the hospital. The baby boys are strapped down with Velcro restraints on a molded plastic board called a circumstraint, specifically designed to hold them down. This picture here is an example with the Velcro holding their legs and arms down. During the procedure, forceps grasp the foreskin and widens the opening of the penis. Next, a metal probe is inserted beneath the foreskin and is moved circularly to detach the foreskin from the glands. A slit is then cut into the top side of the penis. Lastly, an instrument, a Gonco clamp or a Plastibell, is placed over the penis, and a circumferential incision amputates the foreskin. These two pictures are examples. This is a Gonco clamp, and these are different sizes of the Plastibell. It is most commonly performed surgery in the United States, and as of 1998, there were on average 3,300 performed daily. Now that I've explained what circumcision is, I would like to discuss why it is beneficial to keep your child's foreskin intact. Circumcision of infant males removes a functional part of the body. Too commonly, the foreskin is referred to as extra skin, when in reality, foreskin has at least 10 main functions: to cover and permit the development of the mucosal surface of the glands and inner foreskin, to protect the infant's glands from feces and ammonia in the diaper, to protect the gland's penis from friction and abrasion throughout their life, to lubricate the glands, to coat the glands with waxy protective substance, to provide an aid to masturbation and foreplay, to serve as an aid to penetration, to reduce friction and chafing during intercourse, and to contact and stimulate the G-spot of the female partner. The procedure removes 1/3 of the penile system skin. Removing the foreskin removes 20,000 nerve endings, 3 feet of vein, arteries, and capillaries. The amount of skin removed from an infant's penis may not seem like much, but compared to the amount of skin they will have as an intact male later in life is shown by a 3x5 index card. Now that I've informed you about circumcision as a removal of a functional body part, I will go on to explain why circumcision is not medically necessary. Many people are told that circumcision is said to decrease the risk of urinary tract infections, phimosis, which is the inability to retract the foreskin at the age of puberty, balanitis, which is the inflammation of the glans penis, and penile cancer. However, they may not know that the chances of acquiring these conditions are very slim. Less than 1% of males will require circumcision for medical reasons. In developing countries, penile cancer will develop in about 1 out of every 100,000 males and is dependent on factors such as sexual behaviors. The risk for acquiring a urinary tract infection from males is less than 1%. Compare that to women who are 4 times more likely to get a UTI than the intact male. The treatment for these medical conditions is not circumcision. Urinary tract infections can be treated with antibiotics, and balanitis and phimosis can be treated with a topical cream. Leaving the foreskin intact suggests decreased infections. There's a soft mucosal layer that protects the urinary tract from contaminants. Considering we don't remove ears to prevent ear infections and eyelids to prevent infections of the eye, foreskin should not be removed to prevent infections of the penis. As with all medical procedures, there's always the chance of experiencing complications. Immediate complications include the removal of too much or too little foreskin, difficulty breastfeeding, infection, painful urination, and sometimes death. These complications occur in up to 20% of males. Long-term complications can include painful erections, decreased sensitivity, curvature of the penis, impotence, and chafing for the rest of their lives. It is significant to note that the United States is the only country in the world that routinely circumcises most of its newborn males for reasons other than religious beliefs. This table here is a list of countries that do not practice medical infant circumcision for reasons other than religious beliefs, and it's just some of them, and the United States is one of the few countries that is not on the list. Since circumcision is not medically necessary, parents should be sure that they are educated on the subject properly before making such an important decision for their child. Circumcision is the only operation where the decision to operate is made solely by a non-medical professional, the parents, acting with little or very incomplete knowledge of the procedure. When it comes to male circumcision, those with higher education usually report lower rates of consenting. Parents that lack knowledge on circumcision commonly do not understand the pain they're putting their child through. In 1987, the American Academy of Pediatrics stated that local anesthetics are available and considered relatively safe for infants. However, the availability and education of pain management doesn't guarantee the proper action will be taken. A study in Rochester, New York confirmed that while 97% of medical students were instructed to always give proper pain medication, only 84% were compliant. No method of pain control available for circumcision is able to provide 100% relief for the child. The easy availability of circumcision makes it easy to consent without giving it much thought. Currently, circumcision is legal and is covered by most insurance companies. Although health insurances, specifically Medicaid and Blue Cross Blue Shield, are reconsidering their financial support for circumcision. With the pressures to reduce state taxes and many demands on insurance companies to reduce the coverage, Medicaid is looking at the cost-benefit analysis. With many health organizations declaring the procedure medically unnecessary, including the American Academy of Pediatrics, the American Medical Association, American Cancer Association, and the American College of Obstetrics and Gynecology, cost-effectiveness for insurances was evaluated. It was determined that over $500 to $800 million are spent on circumcision per year, and as a result, 16 states have decided to withdraw their financial support for circumcision. In this speech, I explained what infant male circumcision is, how the procedure removes a functional part of the body and is not medically necessary. I also discussed the importance of being educated when making such a decision. In the time it took me to give this speech, approximately 45 infants were circumcised in the United States. The information I gave you today was gathered from several different sources. One of my scholarly sources, called Circumcision, An Informed Choice, was written by a nurse, and my second scholarly source, called Involuntary Circumcision, The Legal Issues, was written by doctors from the Medical College of Wisconsin Department of Pediatrics. I also used two books that I referred to that were written by medical doctors with lots of experience in their field of pediatrics. I also used a couple different websites, such as the American Academy for Pediatrics and the American Medical Association.